This video I want to talk about active surveillance for localized prostate cancer. This is a relatively new term. It's only been around for about 15 years. And it's different than a treatment that is called watchful waiting. In watchful waiting, no one ever gets local treatment to the prostate. They're simply treated when the cancer spreads to other parts of the body, if that occurs. In active surveillance, we now realize that many of the prostate cancers are not going to progress very quickly or may never progress at all. And we recognize that many men are being overtreated for prostate cancer. Active surveillance is a way to try and find a balance in which you're diagnosed, and if you fit into a certain category, then you don't get immediate treatment. You're observed and monitored carefully to see if anything changes. If things change, then treatment would be recommended, some form of treatment to the prostate gland. So it's not like you'll never get your prostate treated, you just may not get it treated immediately. What we know about active surveillance is about 10 years of follow-up. With 10 years of follow-up, in the largest study that's been done, men on active surveillance had a less than 3% chance of dying from prostate cancer. And about 70% of the men have been able to avoid getting treated so far. Nearly 30% have gotten treated, some because they wanted to, some because the tumor changed. So how do we do this? Who's a good candidate? Well, we think that the best candidates are men with a Gleason score of 6, a PSA under 10, and a clinical stage that we call T1C, which means you can't feel any lumps or bumps on the prostate. Also, men that are less healthy might be good candidates to consider active surveillance because maybe they'll never need to be treated before they die of some other disease. Now, if you do active surveillance, the question is, when do you change it? What has to happen? And we have several things that are being used. Number one is what's happening to the PSA. We can calculate the PSA doubling time, which is how fast is the PSA doubling in value. If it's doubling in 3 years or less, we think that's too fast and that those cancers ought to be treated. But if it's doubling in 5 years or longer, well, there may be very little reason to consider treating those people. Another thing many doctors are doing is performing a repeat biopsy at 1 or 2 years, looking to see if the biopsy shows a lot more cancer or if the Gleason score has changed. If the Gleason score increases, that would be a reason to say this is probably not a good idea to continue doing. The bottom line here is we don't have any prospective randomized trials to tell us exactly what to expect. All we know is that many of the men that are diagnosed today probably have cancers that are not life-threatening, and active surveillance strikes a balance between never getting local treatment or getting it immediately when it may not be necessary. It should be discussed in every case of this disease. Now, there are different recommendations. There's an organization called the National Comprehensive Cancer Network that has issued guidelines saying that active surveillance should be the only treatment to consider if you have very low-risk prostate cancer. That means a Gleason score that is 6, a PSA under 10, you can't feel anything on the prostate, and you only have 1 or 2 biopsies that show some cancer cells present, and it's not present in very much of the biopsy. There's an ongoing debate whether that's the best thing to do because we have no studies proving that it will work for 20 years like that organization is suggesting. Bottom line is you should discuss active surveillance. You should hear about active surveillance when your prostate cancer is diagnosed. And if you're a good candidate for it, you should at least understand the pros and cons and consider it along with the other options as you make your decision.